Good morning. This is Vanathi, Assistant Professor, Department of Social Work, St.Joseph College of Arts and Science, Autonomous Cuddalore. This video about my lecture on difference between neurosis and psychosis. Neurosis involves sadness, depression, irritability, anxiety, anger, confusion, and so on. We can say that neurosis is the inability of a person to change their life pattern and unable to develop a more complex, satisfying personality. So, a person with a neurosis can understand that they have a problem that hinder their life routine, but they cannot resolve it themselves. The neurotic unusual anxiety to escape a certain situation um, through their subconscious level. The anxiety experienced by a neurotic person depends on the types of the neurotic disorder. So next, psychosis. So psychosis means a serious mental illness causes hallucination, delusion, fills in judgment, and other such a process is called psychosis. The term refers to a Greek word psycho, which means soul and breathe, and other words psychosis happen when a person has forgotten the essence of his life and the person has designed their view of life which is not shared by others. So, psychosis, the person with a psychosis disorder do not understand that have a problem. They live in the world of delusion and hallucination. Their behavior is a result of beliefs based on the hallucinations. Their thought process, beliefs, and the emotions impair that they lose uh, contact with the reality. They also show great personality change, dramatic mood swing, abnormal emotional response, and a lack of orientation of time, place, and people around them. So neurosis is a mild form of mental disorder. Is a neuropsychological disorder is a conform themselves in the specific clinical phenomena. The neurotic patients does not affect the personality. The neurotic patients contact with the reality is partially lost. Hallucination and delusion are not present in the neurotic patients. Hallucination means auditory and visual hallucination. Auditory hallucination, hearing voice, hearing somebody, noise in the ear, and delusion, some picture, somebody talking, patient. So extremely rare if present in the neurotic patient. Neurotic, the causes of factor for neurosis are biological factors, socio-psychoclimate, psychological, pathological, and socio-economical. And the treatment is usually psychological and medicine can be prescribed. The treatment is psychological means like any other therapies, cognitive behavior therapy, like aversion therapy. So a lot of therapy to give a psychological, and medicine can also prescribed. So medicine, sleeping and anxiety, fear. So medicine can also to be prescribed in the neurotic patients. The treatment is a short-time treatment in the neurotic patients, 6 months to 1 year. And the neurotic disorder, obsessive compulsive disorder is a OCD, so somatoform disorder, depression, post-traumatic stress disorder, or few types of neurosis disorders. Obsessive compulsive disorder is a persistent unwanted thought and beliefs that causes anxiety. To get rid of this anxiety, the person has to perform certain act, behave in a certain way. Example, fear of germs, illness, obsession, like repeated thought, washing of hands in act of compulsion. The person is fully aware that fear is irritational but cannot help from the doing act. Anxiety caused by the obsession thought. So depression means the depression, it is a serious mental health disorder. It can be associated with a bitter life experience, imbalanced chemicals in the body, so feelings of sadness, hopelessness, guilty and shame. So main symptoms of depression is normally such feeling get resolved over time. But when it's a neurotic patients, it can affect daily living the person, such as talking up responsibilities and taking care of family. So next, psychosis. So psychosis is a severe form of mental disorder. Is a severe mental illness characterized by the loss of contact with the reality. Is a fully lost in the reality. The relationship with other people is causing social maladaptation. So the psychosis patients that affect the personality, the psychosis patient reality is completely lost because their consciousness, their concentration fully lost. Hallucination and delusion are present because uh, the patient hearing somebody noise and hearing somebody voice. So hallucination and delusion are present in the psychosis patient. The causing factor for psychosis are genetic, biological and environmental. The causes of factors is a psychosis or genetic factors is a gene, is a infection, uh, organic conditions, that is a genetic factors, is any other family family history of mental disorder. So biochemical and environmental. So environmental is a sudden accident, any other environmental factors, the causes of psychosis. So psychosis a disorder is a schizophrenia, delusional disorder, or few types of psychosis disorder. So schizophrenia is a chronic mental health disorder. It refers to a group of severe mental disorder have a symptoms of hallucination and delusion, is a thought process, abnormal emotions. The patient lack of concentration, poor appetite, the person is totally withdrawal from a reality. The schizophrenia main face the different ways the different individual like some withdrawal into themselves without reacting any stimulus. So while others may have a delusions, the grandiosity, unrealistic and illogical thinking. So that is the schizophrenia. uh, Delusion disorder is a delusion and mania and depressive psychosis. This types also psychosis characterized by extremely mood swinging from the being very happy or extremely aggressive to totally withdrawal, so during a manic phase. So manic and depression means is a episodically uh, manic and depression. And during the depression stage, the person becomes extremely tired, hopeless, totally withdrawn. Such a person may even consider suicide. The person is not connected to reality, but there is no identity loss. The psychosis is treated by anti-psychotic medicines, psychological therapy, social support. The psychotic patients taking a medicine in their entire life. The treatment is a long-term treatment. Thank you.